Hello everyone, and thanks very much to the organisers for allowing me to speak today at this seminar. And Hugh's covered it beautifully, and he said to start small. Well, I started small 15 years ago and I'm still small, only involved with a blog and Twitter. But for my purposes, it's been extremely effective, and it can be for a lot of people. Because, as you said, you make the decision early on whether you're going to move in a little cohort of like-minded people, like-minded researchers, or whether you're going to go out to the public. And my role from the very start was to try and disseminate or broadcast information to the public. And I imagine there'd be a lot of researchers who would do that too. If you've got a particular expertise in some area, it might be vitamin D, or it might be breast cancer, or it might be epidemiology of something. And if you're out there, then people are going to find you, because everybody becomes a guru in time. And this is a cartoon from The New Yorker by Paul Knopf, to give him his credit. And everybody here at some stage will be a guru, that is a teacher. I know who doesn't like the word guru, but it's a teacher, because people will find out about you. If you've got an area of expertise, you might have 3 or 4 people who ask you questions, you might have a dozen, you might have 1,000. They'll want to know because you're out there. And in that way, you're going to have to develop some sort of manner in which you're going to run this properly. And for my definition of properly, I don't mean that you can press the right button when you tweet. Properly is proprious, from proprious meaning intrinsically proper, intrinsically okay in your heart, and we'll talk about that a little bit later. Hugh wanted me to discuss a couple of things about how I did it, and I'm going to allude to those things, Hugh, but I just wanted to cover a couple of themes in the very short time that I've got available. Kevin Foe, who's kevinmd.com, a well-known entrepreneurial doctor, wrote last year that health professionals need a strong social media presence to establish themselves as reputable sources. And this is what health professionals have been doing pretty well forever in various ways. And in 1988, when I first came to the Alfred Hospital as a trainee in allergy, the then my boss, later Professor Dan Zani, said, you've got to go out there and talk to people, because there's a whole lot of rubbish being said about allergy and immunology. And the same is true now. You only have to think about homeopathic vaccination, and you can go on and on and on and on. So those of us who were influenced by him went out in those early days and gave talks, and as much as we could to either the lay people, or to that is the public, or to doctors or their families. And it's Kevin wrote also that this is necessary because, in fact, the figures show that 50% of websites that are talking about health are wrong, have wrong facts in them. They're incorrect, 50%. So there has to be a balance, and there has to be somebody like you guys that go out there and correct this. Importantly, and Hugh provided some stats up there, but if you look at people with chronic ill health, the Pew Research Centre has shown that 31%, and they're usually in the older age group with multiple conditions, 31% have accessed the net specifically to find out about their condition. And 2/3 of them will then talk to their health professional about what they found out on the net. So it goes around in circles like that. So it's really important, and it's almost an obligation for people who are knowledgeable about these things in a scientific manner, that they go out there and talk. Well, what were the results? I'll give you briefly just one slide about me. Before AllergyNet Australia, which is my website, we founded that in January 98. It's a very old one, still running. From 88 to 97, just giving talks. I would communicate with 15 people a week. It was one talk a month. There were about 60 people on the average that would attend. Once I started the blog, the metrics were pretty primitive in those days, but especially in the early half, about 50 people would log on. I don't know where from, I couldn't understand all that stuff. But interestingly, the health journalists cottoned on very quickly, And within 2 years, I reckon, just about every health journalist in Australia would have called me because they used the internet very early in the piece, and they wanted to know, who can I get to talk about asthma? And if you're out there at that time, they would call you and they would start reading your blog and so on. Now, in 2010, I matched Twitter up to the blog, and meaning I went into Twitter. In 1 week in May, using TweetReach, my tweets reached over 124,000 separate Twitter accounts. Now, I haven't done the stats on this, but I get the feeling the numbers have increased. And it's really important, not only that you realise that, you all do, that it goes to a lot of people, but the ability to communicate with so many people is enormous. A quick word about Twitter. There are nearly 1 billion current users. Twitter defines a current user as someone who's logged onto their account once a month. That's all the definition is. It doesn't mean how often they tweet, because 44% of people on Twitter have never tweeted. In fact, only 13%, these are very recent figures, only 13% have tweeted more than 100 tweets. Now, there are a lot of people who lurk out there. Lurking is the term that's used. It sounds disparaging. I don't think it should be. But lurking is the word that's used for people who are on social media but don't chat. They follow, they listen to, like to follow Lady Gaga and whoever, and they might have Hugh on the list, and they read the stuff, but they're not into actually talking to them. I think for consumers, that's fine. There are a lot of people who dislike lurkers. There are blogs about how to get rid of lurkers. We would invite them, because when you've got a lot of people listening to you and listening to your good information, it's well worthwhile. Now, the last part of my talk, because I've only got a couple of minutes left, is just as what we're doing in the department in relation to this very matter. And that's become a meme now. It used to be a lexicon into the English language. It's now a meme, the good, the bad and the ugly. And for your interest, there are 461 scientific papers that have been published since this movie came out that use the words the good, the bad and the ugly in the title. And some are quite bizarre, but the strangest is violent video games. The good, the bad and the ugly, written by a psychiatrist. But I think it gives a nice summary of the internet, but also social media. And the word ugly in my context refers to unprofessional behaviour. And I think everyone can be capable of doing that once you get a group of people who are listening to you. And the PhD that I'm doing is on e-professionalism. And I'm very lucky to be with a group who is studying this seriously, and my supervisors, headed by Dragan Ilic, and also Stephen Maloney and Basia Dug, have done a lot to establish a focused education profile within the department, and are now branching out into social media. And the domains are broadly those groups, but even they're subdivided. So even under communication, a domain of good good professionalism for researchers is to liaise with clinicians via social media. So clinicians to researchers, researchers to clinicians. Most organisations have that as established as a sign of good professionalism. We have embarked on a number of studies. We have the title registration for Cochrane on social media for education. I've been lucky enough to join a large international study that's headed by Steve Maloney, looking at translation of research evidence via social media. We've just got ethics approved on the extended relevance of media multitasking. And outside, there's a lot of work being done, and I'm just a member of a working party on continuing professional development in the College of Physicians using interactive space learning. So we're right at the cusp of a whole lot of good studies, good work, good science on this topic. And my last slide is that this was a social media boot camp from the Canadian Conference on Medical Education this year. The first 5 are what they discussed. They're all very important. The 6th one I have added because in my view, when you're talking to consumers particularly, as experts or gurus, you need to always maintain a professional presence. Thank you.